BPH stands for benign prostatic hypertrophy. This is a condition which is, as the name implies, benign and not related to cancer, and is related to an enlargement of the prostate. The prostate is a gland found only in men below the bladder, and as the prostate enlarges, it can lead to obstruction of urinary flow from the bladder. This can present with symptoms like a slow flow, dribbling of the urine, and also as it gets worse, it can lead to retention of urine and a feeling of incomplete emptying. That means after urination, you feel like there's still urine in the bladder. As the condition progresses, the obstruction can lead to changes within the bladder, and this could lead to symptoms like urgency and frequency, where there's a need to go to the toilet regularly or more frequently than usual, and also to problems like nocturia or nighttime urinations of 2, 3 or even more times per night. So BPH has traditionally been managed 3 ways. The first way for mild symptoms would be a watchful waiting approach to look for progression of symptoms before treatment initiation. The second way, of course, is to start some medications to try and relax the prostate or to try and shrink the prostate. These medications can lead to side effects in terms of giddiness or sexual dysfunction. And the last method is a surgical method, which there is removal of tissue with either a scraping method called TURP or green light laser. These methods have a potentially longer downtime of 2 to 3 weeks, bleeding, sexual dysfunction, and most importantly, a small risk of urinary incontinence. So UroLift is a new method that has been around for about 10 years for minimally invasive management of the prostate. This basically involves, if you look at the prostate, applying a small little implant into the prostate to open the channel. The procedure can be done under local anesthesia or just mild sedation without the need of a general anesthesia. The patient has rapid recovery of symptoms and usually can get back to normal activities by a week. So the effect is such that before the procedure, on a scope, this would be a view of the scope channel looking into the prostate channel. You can see there is obstruction from the sides from the prostate, and after the set of implants are put in, immediately the channel would look open like this with a view into the bladder. The good thing about UroLift is that apart from a rapid recovery, it has no effect whatsoever on sexual function and no risk whatsoever with regards to urinary incontinence. Most patients will find a rapid improvement in symptoms, more so than just being on medications. The procedure has a much lower risk profile compared to the old methods of TURP and even green light laser. There is no effect on sexual function for the patient. There is no risk of urinary incontinence, and there's rapid recovery back to normal activity, normally within 1 to 2 weeks. I mentioned it is done as a day surgery or in the clinic. There is very low risk of requiring a catheter, but in some patients, especially with larger prostates, there may be a need of catheterization for a day or 2. There is going to be some degree of urgency and frequency immediately after the procedure, which lasts for 1 to 2 weeks, but can be managed with medication. And lastly, there may be a little bit of blood in the urine for 1 to 2 days, which normally resolves after that period of time.